Greetings of the day. So this video is for the medicine students and it is for the writing task number 5 where the letter is being written to a specialist. So I'll get the screen on, I'll get the task on screen so that you can have a look at it and can discuss it further. Okay, so I've got the task here now. So how do you interpret a case note? Yeah. So how do you interpret a case note? You have a 5-step strategy to interpret the case note. What is that 5-step strategy? The first step you have is you always read the notes that are given at the top. So here you can see the notes. It says Tracy Bowen is a patient in your general practice. So notes will always be given at the top. They would tell you who you are. Okay, what is your designation? Then after reading the notes in the beginning, you jump to the writing task without reading the notes. Okay, you would read notes later on once you have identified who is the target reader. So I can find the target reader in the purpose of writing in the writing task. So here it says that the letter is being written to an endocrinologist. Okay. The letter is being written to endocrinologist. Write a referral letter to Dr. Suzanne, who is an endocrinologist. What is the purpose of writing? So definitely when you're writing to a specialist, most of the time the purpose of writing is for further assessment and management. And the final part would tell you the assessment and management is for what, right? So here you can see that it says PCOS. So now, keeping that in mind, you start reading through the whole case notes. While you are reading through the case notes, you think what points are relevant for the target reader and what points are irrelevant for the target reader. Okay? So now start reading the case notes with this two things in mind. You are writing to endocrinologist and you are writing for further assessment of polycystic ovary syndrome. So whenever you are treating the patient as a general practitioner, you can have heaps of details about them. For example, here it starts right from 2004 to 2014. Yes, and the intervening period has been omitted. So there can be heaps of notes that you can have. So that is where the main challenge is. How would you decide what information would you include or exclude? So that is to be decided based on who is the target reader and what is the purpose of writing. So uh, one of the examples that you can remember while selecting information is, think about a trip that you have had recently. For example, you went on a trip to Goa or Maldives, right? And after coming back from the trip, you're writing 3 emails. One email goes to your parents, the other one goes to your girlfriend or a boyfriend, and the third one goes to your childhood friend. The activities that you did in Goa would be the same, but the content that you would select for each of the target reader would be related to their interest and what they should know and what they should not know, right? So, for example, when you were on a trip, you might have visited some temples and churches, you might have enjoyed some night parties, met a new girlfriend or a new boyfriend there, you might have done some nasty things there, you might have done some adventure sports as well. But while you are writing to your parents, you would not write about your visits to probably the night parties or pubs. You would not probably write about a new girlfriend or a new boyfriend that you met there, but you would focus more on how your stay was, how was the journey, and probably you would include your visits to temples and churches and probably the shopping that you may have done there. Okay, but if you were writing the same letter to your chatty buddy, the friend, then you would write everything, yeah, because he or she is someone who shares everything with you, or he or she is someone who is non-judgmental. They don't judge you, they are partner in crime. So you would write everything to them. And if you were writing this letter to a girlfriend or a boyfriend, you would definitely not write about a new girl or a new boy that you met there, yeah, the new a handsome boy that you met there or a beautiful girl. So the journey was the same, you were the same, but depending on who is the target reader, your content changes. So always keep this example in mind whenever you have to select information for the target reader. And whenever it comes to OET writing, another element that is important is the purpose of writing, not just who they are. So this is a typical example of identifying how depending on the purpose, information may be selected. So here, if you see, all the information are quite related to endocrinology. You can see that they are all hormonal issues that they have had. But the main reason why you are writing is PCOS, the current situation, and not for the acne that they have had. So even if it is related to endocrinologist, you would not expand too much on it. Right? So while you are selecting or excluding information, you will have to keep 5 things in your mind. You need to exclude information if that has already resolved. So here you do not have any information about acne. It is only about the information that you have probably during the teenage years. And again, um, the second point you consider why you should not include information is, for example, if those problems have already resolved. So here you see the first point says childhood asthma. It is childhood asthma, and childhood asthma resolves by the age of 17 or 18. So at present it is not a problem, so you would exclude that point. Definitely you don't also need the medications for it, but the irregular menstruation is an important point. Okay? Dysmenorrhea is important point. So you are going to include those points. But the stress that they had at that time can be excluded. And about acne, as I mentioned, we're going to write acne as there will be some information in the case notes which you would find is repetitive. So when it is repetitive, you don't need to write it date wise, you can generalize it, particularly if it is not the main issue for which you are writing the letter. So here a lot of times you have acne, and you can just generalize the information in one sentence. You would definitely not need any medication that they took for it, because that is not the main issue why you are writing this. And the candidiasis that they had is again always, it is a temporary issue that probably might be caused by the medication, so that is also now not relevant for the target reader. You would also not need to write the medications that they had been given by the dermatologist, even if the reference to dermatologist can be excluded. Yeah. So the only point that you would include about acne is that they had deep acne for which they took treatment. Okay? But you would need to include the oral contraceptive pills that they took. Then from today's visit. So today's visit, they have mentioned that they got married and discontinued oral contraceptive pills in January 2013, so almost a year before this visit. Still, they haven't been able to conceive and they have amenorrhea, and that probably is causing depression and weight gain. So these all points are to be included. Basically, from the today's visit, everything is to be included except the normal reports. The reports which are normal with, or the reports which are within the normal range can be excluded, but the one which are with asterisk marks are to be included. Then the provisional diagnosis, treatment that you have started, and the tests that you have done. Yeah, so keeping in mind the target reader who is endocrinologist, but endocrinologist should know everything about the hormonal issues. But if you keep the purpose in mind, then they should not know too many details about it. So now when you have so many visits, the next question that pops up in your mind is, what kind of organization would I have? How would I organize my information, right? And that's the natural question. And it's very, very important that you organize your information appropriately, because there are evaluation criteria that particularly assess your ability to do so. So while writing a letter, you can have three types of paragraphing. First type of paragraphing that you can have is based on priority, which means you write the main issue first, irrespective of the chronology, right? So this is the typical case. The case which we are looking at right now is the typical case where you are disregarding the chronology, because the main issue is PCOS and not the acne. So you write main issue first and then you write associated issues. So it may not always be necessary for you to go visit twice. Okay? Then second type of organization that you can have could be chronology. This will be particularly useful if the entire letter is about one single issue and you have 5, 6 recent visits, like over a period of 6 months, recent visits, and the same problem has persisted or the same problem has worsened. So you write visit wise. Whereas, probably in the initial paragraphs, you would write summary of all the previous visits. Okay, and then later on, you may write the current visits. So here, all the visits are related to the same problem. That is why we are following this criteria. Okay, and third type of paragraphing you can have is problem and solution. So this is mainly when you're writing to a general practitioner, because patient's general practitioners particularly, because when you write to a patient's general practitioner, what may happen is you may need to report them everything. You may need to talk about wound, you may need to talk about medication, you may need to talk about mobility, you may need to talk about diet, physiotherapy. So you have different problems and different recommendations that you have given to the patient. So what you do is in the second paragraph, say for example, if you talk about their wound, then you write everything about the wound in the second paragraph and what is to be done about it in the same paragraph. And then on the next paragraph, you go on to write about another issue, for example, mobility. Okay, and what is their current mobility, what recommendations are given, and what the doctor needs to do about it. Similarly, when you are writing a referral letter to a community nurse who is responsible for doing four or five things, there also you can go problem solution wise. You can tell them that this is the problem, so you need to do this or those things. Right? So that would be problem solution. So whenever you are deciding about your paragraphing, you have to think from these three possible ways of organizing your information. One way is based on priority, which means you highlight or you try to prioritize the latest visit, and all the other issues go into the later paragraph. So maybe first 2 3 paragraphs can focus on the current issue, and other paragraphs can focus on the associated issues. If you write chronology wise, then you go visit wise, okay, and then problem solution. So in this letter, we are going to go priority wise. We are going to go priority wise. So what is the priority that we are trying to highlight? We are trying to highlight the PCOS, right? So always in the first paragraph you write, it is very, very important that in introduction paragraph you have written the probable diagnosis and purpose of writing. So if I just say I'm writing to refer, it is not purpose. Okay, refer for what? That is the purpose. Are you referring for surgery? Are you referring for assessment? Are you referring for treatment? Are you referring for, say, for example, the dietary guidelines? Are you referring for physiotherapy? So that has to be clarified in the first paragraph itself, because the out of the evaluation criteria, the purpose criteria looks at this. It looks at your ability to clarify the purpose of writing. So if you just write, I'm writing to refer, it is not the purpose of writing. You have to specify refer for what. So those two things you would include in the introduction paragraph. Introduction paragraph has to be very brief. It should look like a trailer of the movie. It shouldn't include, the social history of the patient. It shouldn't include the general history of the patient by saying that they are married and have 2 children and 3 children, and those things should not go in the introduction paragraph. It has to be a trailer. What is the main issue and what do you want the target reader to do? Only those two things should go in introduction paragraph. Okay. Then in second paragraph, now here we are going to go priority wise. So what is our priority is today's visit. So you are going to write about today's visit in second paragraph. Subjective and objective findings. Now, if you straight away write about this and if you do not mention that they already have irregular menstrual period, then that wouldn't be appropriate, because in case of PCOS also it starts right from the beginning, right? So you would start your second paragraph by saying that since menarche. So here, this is where the OET assessor can check your flexibility. For example, you can't start second paragraph by saying on 28/8/2004 she presented to my clinic with irregular menstruation period. No, because this is your main purpose. Today's visit is your main purpose. Now, in today's visit, also, if you directly start difficulty conceiving an amenorrhea, that is not going to make sense if you don't write about the fact that they have had, irregular menstruation period. It is not that something that has suddenly started happening. So, whenever the past medical history is directly relevant to current problem, or whenever the past medical history is a reason for the current problem, then those things should be written in second paragraph. So this is slightly different organization that you might find in this kind of letter, because here we are trying to explain that they have had this problem, and then in continuation we would be writing about today's visit as well. That is quite unusual. We usually don't do that. We usually we don't merge two timelines, but here, because we have to explain that they already have had this problem right from the beginning, that is the reason we are merging them, right? So also being on oral contraceptive pill would go in second paragraph, so that I can mention that in spite of discontinuing them, they haven't been able to conceive it. So how would I start my second paragraph? Probably would not be with a timeline. I would rather say that Miss So and So has had irregular menstruation period along with dysmenorrhea since menarche, for which they had been, now because she is not on that medication, so I would use past perfect tense, for which they had been prescribed with low dose of oral contraceptive pill. Okay, then from this I would directly jump to 2014. However, they discontinued oral contraceptive pill in January 2013 after getting married. Today, directly I would jump to today's timeline. So within one paragraph, I would have three timelines: menarche, January 2013, and today. Today, she visited my clinic as she has been unable to conceive in spite of stopping medication and has had amenorrhea. Okay. And then in the same paragraph, you can write about the other findings. You can mention that on examination, they were found to be overweight and had low blood pressure as well as hirsutism. Then in the third paragraph, you can go on to write about the test results and what have you prescribed them. That would be your third paragraph. And in fourth paragraph, you can write about the medical history. Okay, that is acne, the other contributing factors. You can also, if at all you want, now it is completely irrelevant because it is childhood asthma, so that has now resolved. But if at all you include it, it should go in the fourth paragraph. Okay? Regarding other medical issues, they have or she has a history of childhood asthma as well as deep acne. That's all. You would not need to say what all medications they had been given, because that was the subject of dermatologist, right? And then that is not the reason why you are writing this letter. So these are very, very important things apart from correct grammar. Grammar is just one of the evaluation criteria out of six, whereas the other five evaluation criteria look at your ability to choose relevant information, your ability to paragraph appropriately, your ability to be able to generalize where you need to generalize, your ability to expand on certain notes. Those are important factors. And here in the assessment, it says query PCOS, right? So in introduction paragraph, when you write, you can't say that they have been diagnosed with or she is diagnosed with, because it is still a query. So you will have to say signs and symptoms suggestive of, signs and symptoms indicative of, or signs and symptoms consistent with polycystic ovary syndrome. So these are the important things that you have to keep in mind while writing such letters. Right? And the evaluation criteria are to be kept in mind while you are writing the letter. So if you probably in this kind of letter, if you go visit wise, you will score poorly, very poorly in organization and layout criteria, because you could not prioritize the information. Yeah, this was not the priority, this is the priority. Similarly, if you had started your paragraph by saying, on so and so date she presented to my clinic with complaints of this, that wouldn't suit genre and style of this letter, because you are writing to endocrinologist for PCOS. That means you should, rather than going about their visit, it really doesn't matter when they visited you. What matters the most is for how long have they had these symptoms. That matters the most. So that is where genre and style would get affected. Similarly, if you include a lot of information about the treatment that they received for acne, you are going to score poorly in conciseness and clarity. Because if you include so much of information about acne, which is not relevant for the target reader, okay, that will be considered as irrelevant information for the target reader. So you would score poorly in conciseness and clarity in that case. And definitely when you would include a lot of information which is irrelevant, you would not be able to highlight information which is relevant. So definitely you are going to score low in content criteria as well, again, because you already have a lot of information to write. And the content criteria tells you to highlight relevant information. So how do I highlight? I can't write in capital. I can't use highlighter to highlight it. So how do I highlight? I highlight it by not hiding it under a lot of information. If I hide it under a lot of irrelevant information, then I can't highlight it. So the only effective way of writing letters with B level or A level is your ability to exclude irrelevant information and your ability to generalize and summarize information which is not so relevant, which is associated symptom, for example, right? So you would need to keep those things in mind. And definitely when you are trying to generalize information, or when you are trying to, write in a concise manner, you would definitely need a lot of language resources in terms of using compound and complex sentences appropriately. Only then you would be able to write a good summary. So a combination of all those factors would decide what is your score. Otherwise, they wouldn't give 45 minutes if the paragraphing was every time the same. Yeah? 45 minutes are given for that reason only, because you need to interpret, you need to plan, and then you need to write. So you can't every time have the same kind of paragraphing. You will have to logically think about paragraphing for that particular case. So I hope this video helps you to understand how a letter is written to a specialist, particularly when you are going to organize it in terms of priority.